So in this skill, I'm going to be performing the wound irrigation skill. So I already assessed the wound, I already reviewed my medical orders, and I already explained the procedure to this patient, and they are familiar with it because it has been cleaned and irrigated before. So now I'm just showing the supplies that I'm going to be using, my solution, the gauze, the syringe, my sterile gloves, my non-sterile gloves, and then I have my cup for my solution to be poured in. And underneath this whole setup, I have a waterproof bag, so none of the other items get dirty if that were to happen. And I'm just setting up my supplies. I'm washing my hands, and I'm going to be placing my non-sterile gloves on. And I'm going to be removing the abdominal pad and any other gauze or packing that was placed before. And now I'm going to be placing my sterile gloves. And just a note that if this were a bigger area, I would have more room and I would be placing things differently. But for the sake of the skill and the time, the area that I had, it's going to be a little bit more squished in. So before I place my gloves, I'm going to drop all my non-sterile items onto that sterile field. My cotton applicators, my gauze as well. Once again, if I had more room, the wound would not actually be on the paper of the sterile gloves. So now I'm just measuring, taking note of any characteristics, the length of it, and I'm going to be comparing that to my paper to make sure I can remember these measurements and note them in my chart when I'm done with this procedure. Now I'm going to use my syringe to irrigate this wound. In my previous video, I said that this wound was pretty much healed, and so I won't be needing to irrigate that much because in this specific patient, I would note that the solution was draining clear, so it did not have to be repeated multiple times. And I'm just drying off with any excess using a sterile 4x4. And I'm applying these sterile 4x4s to cover the wound and applying a abdominal binder on top to secure it. Remove of my gloves, dispose of my supplies, make sure my patient's in a comfortable position, side rolls up, collards within reach, wash my hands, and record.